Many businesses in China have resumed operations starting from February the 10th, and millions of people have been traveling to large cities from home. As the country continues the fight against the novel coronavirus, how can the risk of cross-infection be minimized? How far are we from effective medicines and a potential vaccine? And how much will the world's second largest economy suffer from the impact of the outbreak? To discuss these issues and more, I'll be joined by Professor Chen Hong from East China Normal University, Huang Yanzhong, Senior Fellow for Global Health at the Council on Foreign Relations, and Amesh Adalja, Senior Scholar at the Johns Hopkins Center for Health Security. That's our topic. This is a dialogue. I'm Yao Rui. Welcome to our discussion here. I'm sorry we cannot be joined in person by our guest speakers due to the special reasons during the special period. But let me go to Chen Hong for your thoughts on how far are we from the turning point where we're going to see apparent signs of a drop, if not a sharp decline, in the number of confirmed cases. Let us know very quickly your thoughts.
Well, I think actually we need some time actually to assess the current situation. The current situation is still actually full of uncertainties. People talk about, current situation being still there's still a lot of questions, being awaiting, to be further assessed and ascertained. For example, like, how many people are really, across country, apart from Wuhan, from Hubei, who are, being affected, and actually about incubation periods. It is being expected that maybe by the end of this month or early next month, actually, there will be the peak or the plateau or the turning point. But I think actually there are still some kind of complexities, unforeseeable complexities, and we need some kind of further, assessments to so in other words, we need to be patient and actually, to be, fully prepared for various scenarios.
Well, let me cross over to Huang Yanzhong. Do you think the worst is yet to be over, or we're going to soon see the turning point?
Well, I think if we define the so-called turning point or inflection point in terms of we see that this drop of those confirmed and suspected cases for consecutive 14 days, then I think it's very likely that we're going to see this inflection point arriving around February 20th for most parts of China, except Wuhan.
Let me give this question to both of you. Obviously, people's patience is wearing thin quickly at this moment, after about, for many of them who went home to have family reunions with their parents, now their patience is wearing thin very quickly. What does it take to quickly resume confidence of the general public? Is it more about their jobs, the recovery of the economy, or a quick end that could be applied to their quarantine? Now, what needs to be done to ease the public sentiments, which obviously show signs of anxieties?
Okay. Well, I think it's very important to take an integrated approach to addressing the outbreak. I think it's important to continue this containment-centered approach to reduce the number of confirmed cases and suspected cases. But in the meantime, I think it is also imperative that we don't allow this panic and also containment-based approach to significantly undermine the economic capabilities of the nation. So it's, I think, very important to resume work and the factories reopen.
Yes, Chen Hong, what do you think of a therapy that could quickly ease the public panic?
Indeed, I think there is a definite need, to strike a balance between, tackling the virus and also resume production for their economy. So as of today, actually, we know that actually millions of people, are returning to cities where they work. In Shanghai, for example, we have seen a visible increase of people in the streets on public transport and also in the food markets and supermarkets. And, there's also a kind of like, encouragement, businesses and also the agencies, government agencies are actually advising their employees to work from home. So in other words, on one hand, actually, extreme precautions are being taken. On the other hand, actually, business is being resumed. For example, like in Shanghai Stock Exchange, at the entrance, you can see people wearing masks, wearing gloves, even wearing goggles. And you see security, guards, dressed in those blue biohazard, suits. It looks like a dystopian science fiction, scenario. But actually, that means, that scene actually means business is still going on. So in other words, business is still going on, but actually extreme precaution and self-protection is being exerted.
Look, Yan Zhong, compared with what happened 17 years ago, I'm talking about the SARS outbreak, the mortality rate is after all only around 2%. That's pretty low. Why do you think people still feel scared?
Well, I think it's because we still don't know much about the nature of the virus, right? Even for that mortality, it's subject to interpretation. In some areas like Wuhan, it's apparently much higher than other parts of China. And the second reason is that this fear and panic associated with the nature of the virus. So even though that in terms of virulence, it might be lower than the SARS virus, the transmission rate and the panic associated with that, I think has made this a much more dangerous pathogen.
It might be ridiculous to say that people were waiting to die when they were facing, obviously, a short supply of medical equipment or even doctors themselves in the limited number of local hospitals for Wuhan and the residents in the city, which was hit hardest so far. But elsewhere around China, people can enjoy much more medical resources to quickly either cure the pneumonia or fears themselves. So still the question as to whether what's happening is a little bit overblown, quote unquote. Ken Hong?
I think actually in different cities, for example, like in Shanghai, there is actually a general calm among the people. People are actually exerting extreme self-protection, precaution measures. That is very important. But on the other hand, there are still some worries. For example, like as of today, as I just mentioned, millions of people, are returning to different cities, including Shanghai, from various parts of the country, including, afflicted areas, in China. So there is actually worries, and actually I think so far the government has been, exerting quite good policies to control, this kind of panicking situation. But still, as we know that actually this, because of this uncertain nature of this disease, so there are worries among the people, and especially against the background that actually, for most of the hospitals, the best doctors are actually, in Wuhan, in Hubei, supporting, providing aid and support in those areas. So people are also developing some worries. But as far as we know, that actually in Shanghai there are screening and also quarantine schemes being imposed at home and also community levels, and also across the city in metro stations, on buses, and also in the shopping malls. See those temperature-taking spots. Simply trying to check people and trying to contain the spread of the movement of the people. So I think actually, generally speaking, the public sentiments are still quite calm. But on the other hand, there is a latent worry that is lurking. So we need to be prepared for such kind of sentiments.
Now let's look at the issue of people coming back to their home, their second home, other than parents, they are coming back to where they stay, their work, like in Beijing, Shanghai, and other first-tier cities. Weather will go back to normal. With so many people coming back in their millions, what's the possibility of resuming our business, economic performance? Now, by the end of the day, everybody would have to ask the same question, whether we'll be able to stabilize the economic performance to reverse the downward economic spiral. I mean, without a steady economic development, it means the loss of millions of jobs, perhaps. It's no exaggeration to say that unemployment would be the most devastating political issue for leadership in this country at different levels. So let me ask Yan Zhong, are you optimistic or cautiously optimistic,
well, I think,
or the other way around, about the quick economic recovery?
Well, I think we have to keep in mind that it's different from the SARS outbreak, right? This time, the impact on the economy is not just on the demand side. And by demand side, I mean there's people reduced the consumption, right? By avoiding the entertainment centers, by not going to the restaurants. But here, different from the SARS outbreak, we see also the impact on the supply side, because the workers, because of this quarantine measures and also the lack of the facial masks, they are refrained from going back to work. I think this is my main concern here, that, for example, whether we do have adequate facial masks for the workers, right, to reduce the potential cross-infection and also the confidence for people, and increase the confidence for them to go back to work.
Due to the boom of e-commerce in this country particularly, China is, of course, blessed by the prosperity of e-commerce. Does it mean for most of the small and medium-sized enterprises who rely on the internet for the success and perhaps survival of their modest business, do you think they feel quite divided sentimentally or in terms of their decision-making about whether they should follow advice of the local authorities, follow the instinct of their business? What should they do? I mean, for them, it's to be or not to be. It's a matter of make or break at this difficult moment, right? So
exactly. I think for those factories that could allow the workers to work from home, and I think definitely they should be allowed to do so. But for many factories, you have to have the workers work on the assembly line. For example, it is actually time to consider resume the work and reduce the damage on the economy.
Right. Thank you so much. Let me go back to Chen Hong. What do you think of the chance for small and medium-sized enterprises to survive the adversity of the current economic situation?
Well, since last year, we've been talking about black swans and gray rhinoceros, the gray rhino. But I think actually in this year, this epidemic outbreak is indeed both a black swan and also a gray rhino. But to speak the truth, actually, to say the truth, I think actually we're not really fully prepared for this scenario. The small and medium, enterprises, the SMEs, are the most vulnerable, in the face of such a kind of, economic public health crisis. And for example, SMEs actually, in China, across the country, they take about 70% of their employment. And against such a kind of situation, actually, they're the most vulnerable. And some of those small and medium enterprises are facing, temporary suspension or even close down. And the employment situation can be, having this kind of hazard, latent hazards, quite imminent. So some of these, the local governments, such as Shanghai government, and also some other cities, have been, providing and offering some supportive measures, such as, reduction of the tax and also exemption of the rent, and those are quite proactive in supporting those enterprises. I think these are very important, and so far has been providing incentive and encouragement for those enterprises. But on the other hand, of course, for those enterprises, most of those small and medium enterprises, they concentrate in the catering, hospitality, such sectors, and those sectors are actually hit the worst. And so I think actually there are, some kind of public, confidence in the government's, willingness to support those, policies. For example, there are some calls for governments to have, more, some kind of easier monetary, policies, and also some kind of deregulation of some certain particular channels of bank loans and some other channels of support. So I think actually, in general speaking, there are channels and policies being considered both at the government and also suggested by the enterprises and businesses.
Thank you very much, Chen Hong. Let me go to Mr. Amesh Adalja, Senior Scholar at the Johns Hopkins Center for Health Security, but we have to wait a few minutes. Chen Hong, another question. Let me go back to the disease itself. The roots of the novel coronavirus infection includes the transmission via aerosol, according to health and epidemic prevention experts. What does that mean for the general public, and how effective are masks at preventing the spread of the virus?
I think actually the most obvious way of transmission is so far the droplets. The people who are within actually a certain distance of the infected patient. If the person exhales or sneezes or coughs, the droplets can carry those pathogens which can be contagious. For aerosol transmission, it is still being it is still quite a controversial, situation in which whether actually the air can be carrying the pathogens and whether the pathogens can be surviving in the air, for a certain period of time. Another, I think actually quite important channel or way of manner of transmission is fomite transmission by touching. So on one hand, of course, I think actually masks are actually our last line of defense. So for people going out, for people to be, going to work in the shops, in the streets, there's a definite need to wear masks that will really be stopping, from separating themselves, protecting themselves from, they're catching their contagions. But on the other hand, of course, there's a shortage of masks in China, across the countries. There are still a shortage of masks. There's a worrying situation. I think actually we have been, seeing in the social media about people improvising masks. They make masks themselves from plastic bottles, from paper bowls, from even, orange peels. These are actually very ineffective. They cannot protect themselves from their contagions. So, but sometimes people can simply be out of their desperation. They can be making those masks, but these are really quite unsafe means. On the other hand, I strongly suggest people also wear gloves, because fomite or by touching, transmission by touching, this is also a very direct means. And wearing gloves, wearing masks, stay away from crowds, and trying to wash your hands or even sterilize your hands whenever possible. These are all very important self-protection measures.
Yes, indeed. What's happening throughout China could be viewed as yet another wake-up call following the SARS outbreak 70 years ago. Let me go to Amesh Adalja, a senior scholar of health security from Johns Hopkins Health Center in the D.C. Now, Amesh, given the hindsight wisdom of our crisis management concerning SARS, Ebola, swine flu, and H1N1 that happened these years, are we going to see an apparent breakthrough in the research and production of vaccines? Because so many people are hopeful that scientists will join hand throughout the world in delivering very effective therapies and, of course, vaccines in the end. What do you think?
I do think that vaccine development is accelerating very quickly. In 2020, we now have important new technologies that can reduce the time to making a vaccine. And I do think we will see clinical trials for a vaccine start in a matter of months. However, it's important to remember that even if we can get something in clinical trials, the ability to manufacture it in large enough quantities to give it to many people in the world is not the same thing. And I do think that we will not have enough quantity of vaccine, even if we make one, for at least a year. This is a long process, and I don't think that the vaccine is going to be the solution to this first wave of this new coronavirus. It may help in the future for future attacks of coronavirus, but for this attack, I don't think it will be ready in time.
The epidemic outbreak in China has captured attention from around the world, and the United States is no exception. However, given the structural geopolitical rivalry in many ways, of course, bioengineering is a very sensitive area, but do you see, ironically, greater chance for the two governments to join hands, encouraging their scientists, making a concerted effort in fighting their common enemy, the novel coronavirus? To what degree do you think scientists from both governments, from both countries, are going to join hands and find a way out?
I do think that we will see a lot of scientific cooperation, not just between China and the United States, but between China and the world, because this is now a world problem, because we have this virus in over 24 countries, and it looks like we're going to have a mild pandemic. So you will have to have collaboration between scientists, and we've already seen some collaboration, obviously, with the sequence of the virus being distributed to the world. And now with the World Health Organization team in Beijing, in the epicenter in China, hopefully we will get more information, and this will be a spark to get more collaboration to try and understand this outbreak and come up with solutions to it.
You know, Amesh, many Chinese show signs of gratitude, and they highly appreciate the humanitarian relief that's coming from so many parts of the world, including the United States, despite the adversity of the bilateral relationship for more than 2 years. Now, a few days ago, there's an article published by Wall Street Journal by Mr. Mead, a columnist for this renowned newspaper. This article is unfortunately entitled "A Very Sick Man of China in Asia," something like this. That caused an uproar in public debates and discussions in China about the image that many Americans try to cultivate negatively, despite the epidemic that has affected so many people in their millions. What do you think of the impact of this article? I mean, many Chinese, even including those who have lived and worked in the United States for years, and they say if they sadden the hearts of the Chinese at this special moment, we could somehow compare their nasty words to derogatory comments following 9/11 about the public sentiments in the United States. Now, the same can be said about how the Chinese are feeling about negative comments on our fight against the pneumonia. What do you think of the public sentiments here? It's an issue of sense and sensibility, make or break, to be or not to be. We should join hands, but why do you think we see negative comments at this moment, Amesh?
Anytime there's an infectious disease outbreak, there is a tendency for humans to stigmatize other humans, and I don't think that's been productive. I think it makes things worse, and there have been reports in the United States of people being treated badly if they are from Chinese descent because of this virus. I think that needs to stop. Viruses don't respect nationalities. Anybody is at risk for this virus, and it's important to remember this, not just for this outbreak, for every outbreak. This happened during Ebola. This happened during H1N1 with stigmatization with Mexico. It's happened over and over and throughout history. So this is nothing new, but it needs to end.
Imesh, again, one more question for you, because you come pretty late. A very famous Chinese scientist in the medical field, like Dr. Zhong Naishan from Guangdong province, said recently in an interview that the growth of confirmed cases will continue for a while, but I believe it won't be too long, quote. How optimistic are you that his projections are accurate, and what are you expecting at this moment? Imesh?
I'm expecting case counts to continue to grow. Right now, I think that this is spreading very efficiently within the community. There are many mild cases that are likely transmitting. This is a virus that is going to probably establish itself, but it will have that seasonality of coronaviruses. So we will probably see cases taper off once we get into spring. But it's really important that we understand how many mild cases are in the community, because that will change the risk perception of this virus. If the case fatality rate falls because there's many mild cases, that will really change the way people are approaching this, and it will decrease the panic.
Again, imagine, you know, a few years ago when H1N1 broke out, up to 300,000 people were killed, unfortunately, and yet no such signs like a panic occurred whatsoever in your country. Do you think this is a matter of being calm, public confidence, or it's very much about ignorance that proved to be very expensive?
I think that what happens is that when there's an infectious disease outbreak, the quickest solution that politicians turn to are travel bans and quarantines and trying to contain a virus. And interestingly, the same thing happened in China itself with a quarantine of 60 million people using very aggressive means to control it. So that is a natural tendency, and it doesn't follow the science, though, because if you have a community-spreading respiratory virus, it's going to not be containable. I do think that there is a lot of panic because people are hearing about the severe cases, the people who have died in China, but they're not understanding that this, for the vast majority of people, over 80% of people get mild illness. I think once that is well established, the panic will decrease as people understand this is more like 2009 H1N1 influenza than something more dangerous. But it really has to, it's going to take some time to change the minds of policymakers and politicians about moving from containment to mitigation.
Well, not surprisingly, we have a different voice from the United States about the impact of the current pneumonia outbreak. Let me go back to Chen Hong. The death of Li Wenliang, the Chinese doctor who tried to issue the first warnings about the deadly coronavirus outbreak, is exceptionally saddening, of course. What do you think needs to be done to better protect the medical workers fighting the pneumonia? Because they are human. They also need to be protected, right?
Right. It's very important to protect healthcare workers. They are the front line. So they need to have adequate...
Yes, I think actually the Dr. Li Wenliang's case is particularly tragic. Because, you know, Dr. Li Wenliang, firstly, is a victim of lack of transparency of information. The Wuhan authorities, at a certain stage, actually tried to, stop the flow of information, which actually was a direct cause for the spread of the disease. That was actually one lesson, brutal and sad lesson that we need to remember and also learn. On the other hand, of course, we really, this is almost like a wake-up call that we need to exercise relentless systemic, reform at the administrative levels. On the other hand, of course, there are now, thousands of medical professionals working at the fronts, fighting the disease, fighting the virus. I think actually we need to take care of those professionals in particular. They are working with such intensity and hardship, both physically and also psychologically.
Thank you very much. Thank you very much, Chen Hong. We understand very well why there has been an outbreak of public anger about Li Wenliang. Of course, the investigation team has been sent by central authorities to figure out what was really happening. Someone needs to be held to the account, I'll see you next time. Goodbye.